guys, welcome back to my video. I'm from Sri KV English School CVV Campus Chikballapur participating in Corona Contest 2021. I'm Esther Paul from Class 8 Section A. Before going to the topic, I'm going to discuss about coronavirus. What is coronavirus? Coronavirus is an infectious virus which enters into the body and breaks down respiratory system and nervous system. It belongs to family of coronavirus that is SARS-CoV-2. It is named corona because of its crown-like spikes on its surface and is widely spread around the world. Let's learn about the origin and spread of coronavirus. Coronavirus normally circulates from animals to human, but the first case of COVID-19 was reported from Wuhan in China in December 2029. Before COVID-19, similar case of coronavirus called SARS-CoV was first found in China 2002. Some reports suggested it was occur in wildlife market in Wuhan in China, but it was found that who are infected has not visited the market previously. Others believe it is planned by a bioweapon genetically engineered in a lab of Wuhan. While there are reports that say that it was developed as a potential cure for HIV and was accidentally released from the lab. Scientific reports suggest that it is a natural virus but not a man-made virus. Another report suggests that it is a combination of bad virus and a pangolin virus. And let's talk about the spread of corona. The first case was found in China, and the spread of corona or transmission of corona is through when someone coughs or sneezes from infected person or touching contaminated objects. The total number of cases worldwide is 18 crore and the total number of deaths is 38 lakhs and the total number of recovered cases is 16 crore. Let's learn the symptoms of COVID-19. The symptoms of COVID-19 are fever. After 2 to 7 days, develop a dry cough, mild breathing difficulties at the outset, gastronomical issues, diarrhea, general body aches. Severe symptoms: high fever, 100.4 degree Fahrenheit or higher, pneumonia, kidney failure, death. Preventive measures to combat the pandemic or tips to prevent coronavirus transmission. Wash your hands frequently as much as possible. Cough or sneeze into your elbow or use tissue paper. Dispose of tissues immediately. Avoid contact with others. Practice namaste. Avoid crowds and public gatherings. Avoid touching your face because of risk of infection. Clean all shade surface frequently. Avoid all non-essential travel or avoid traveling. Call ahead before going to a clinic or a hospital. Isolate yourself if you are sick at risk of complications. Work from home if possible. Wear a mask if you are sick, have COVID-19 or caring for someone with it. Let's learn the impact of corona on personal lives. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of unnourished people is currently estimated at nearly 690 million, could increase up to 132 million by the end of the year. Nearly everybody faces this. Many of them are suffering from this pandemic a lot. This pandemic is not also affecting our daily life or needs, but also our mental health. Some of them, but more of them, are suffering from depression, anxiousness, and are stressed. Epidemiologists and virologists around the world are scrambling to understand and prevent the spread of novel coronavirus. While there is another group of doctors or researchers who are concerned about slightly different toll, that is the mental health pandemic. This coronavirus or the pandemic is also affecting the educational system. Impact of COVID-19 on education system. According to research, at the time of mid April, a total of 1.725 billion students globally has been affected by the closure of schools and higher institutions in response to COVID-19 pandemic. According to UNESCO monitoring report, 192 countries has implemented nationwide closures, about affecting 99% of world's student population. In response to closed courses, UNESCO recommended the use of distance learning programs and open education apps and platforms that schools and teachers can use to reach learners remotely and limit the disruption of education. And due to this online learning, many of them are addicted to mobiles for the sake of online classes. The impact of lockdown on education system is severe, but also an Indian economy. Now let's talk about the impact of corona on Indian economy. According to Times of India, Indian economy has been hit hard by the second wave of COVID-19 pandemic. Though it appears that the economic damage during the second wave has been less than 2020, there were two primary reasons behind the assertion. India has vaccines against the virus and no nationwide lockdown was imposed. But after 3 months after first signs of second wave emerged, India is struggling to vaccinate its most population and strict lockdowns remain imposed in all parts of country. Data on jobs, income, household income, consumer sentiment and demand show the second wave has had a devastating impact on India's economy, especially on poorer citizens and smaller business. After seeing all this, it's very important to stay safe from coronavirus. So the best way is to get vaccine. There are vaccines available in India that are Covaxin and Covishield. ICMR, Indian Council of Medical Research, is the prime institution for doing research on COVID 19. The following steps were framed depending on the severity of infection. Asymptomatic. Need to maintain only SMS. Mild, moderate. Need to isolate and use viral drugs. Severe. Need hospitalization. Life threatening. News or needs ventilator support. And antiviral drugs were made inexpensive. RT-PCR and rapid diagnostic kits were made available all over India. Created an awareness to get general public regarding how to fight and avoid unnecessary fears. Antiviral and steroid injections were prescribed. And the conclusion is, be informed, be prepared, be smart, be safe. Be ready to fight COVID 19. So follow all precautions and stay home, stay safe. Do subscribe our channel, like, share so that we get many likes. Thank you.